Hey everybody, did you ever wake up feeling more exhausted than you went to bed? Did you know that your sleep position can significantly impact not just the quality of your sleep, but your long term health as well? And what about your pillow? Is it enhancing your sleep and health, or is it hindering it? I'm Dr. Tom Neblett with 4 Points Family Chiropractic. Welcome to our Living to 100 webinar series. I'm thrilled to have you with us today. Over the next 15 minutes, we're going to dive into the art and science of optimizing your sleep for better health and well-being. Here's what we're going to cover today. Number one, the critical role of quality sleep. You're going to discover why a good night's sleep is vital for both your physical and mental health. We're going to talk about the impact of sleeping positions, and you'll learn how the way you sleep can determine how rested you feel when you wake up. We'll also talk about the importance of choosing the right pillow based on your preferred sleeping position as well as any health conditions you might have. Along the way, I'm also going to share tips on simple changes you can make to improve your sleep quality. And by the way, one of the most common pieces of feedback we receive from our patients is that they sleep better thanks to the chiropractic care they receive at our office. By the way, our office is located in Northwest Austin at the entrance to the River Place subdivision on Ranch Road 2222, but we proudly serve patients from all over the Austin and surrounding areas. So if you're curious to see if chiropractic care might help you sleep better, or if you have any other issues you've been considering talking to a chiropractor about, stay tuned for a very special offer we're going to make later on in this conversation, a discounted initial examination where you can come in, get checked out, and see if we might be able to help you with your issues. All right? Are you ready to transform your sleep? Well, let's get started. First, let's dive into why sleep is so important. We often hear that we need 7 to 9 hours of sleep a night, but why is that so crucial for our health? You may or may not be aware that sleep is the time your body uses to repair itself. During sleep, growth hormones are released that repair muscle tissue, boost our immune system, and regulate metabolism. When you skimp on sleep, you rob your body of this vital repair and reset period. But it's not just about your body. Your mind needs sleep too. All right, during sleep, your brain processes and consolidates memories, solves problems, and clears out waste products that accumulate during the day. This is why you might feel mentally foggy or forgetful after a poor night's sleep. On the emotional side, lack of sleep affects the balance of hormones. Hormones like cortisol, which is the stress hormone, and serotonin, which is the happiness hormone. Poor sleep can lead to irritability, mood swings, and even can increase anxiety and depression. Now, good sleep isn't just about quantity, of course, it's also about the quality of your sleep. Poor sleep can leave you tired, sore, and stressed out, but when you implement the right habits and setup, you can wake up feeling refreshed and energized. To enter restorative sleep means you have to get into those deep sleep cycles, which is one of the reasons that comfort and sleep position are so important to make sure you enter those deep sleep cycles. So let's talk about how sleep position can directly impact the quality of your sleep. All right, I'm going to talk about the most common sleep positions and the pros and cons of each. So first, let's talk about back sleeping. It's probably one of the best positions to sleep in. When you sleep on your back, it's best for spinal alignment because it evenly distributes body weight. It also reduces neck and back pain by allowing the spine to stay neutral. It's the position that's most easy for your spine to remain neutral. Another benefit of back sleeping is it minimizes the effect of acid reflux because your head tends to be slightly elevated above your stomach when you're lying on your back, and that helps keep the stomach contents inside the stomach. Now, there are some drawbacks to back sleeping. The main one is that if you struggle with snoring or sleep apnea, they can be worsened because gravity tends to cause the tongue to fall back further into the throat, which can block the airways. So if you suffer from sleep apnea, it's a good idea to either avoid this position or at the very least discuss that with in a consult with your healthcare professional. Now, a second position we recommend is side sleeping. Benefits of side sleeping. One, it helps to reduce snoring by keeping your airways open. It tends to improve circulation. It's particularly beneficial for pregnant women because it can enhance blood flow to your baby. And it also tends to relieve back and neck pain by maintaining spinal alignment. Drawbacks from side sleeping. Number one, it can cause shoulder and hip pain because it tends to create pressure points in those areas when you sleep on your side. Side sleeping may lead to facial wrinkles from the pressure put on the skin on the side of your face when you sleep on your side for long periods of time. And also, side sleeping can cause spinal misalignments if the pillow you use doesn't adequately support your neck. This can lead to potential posture issues, degeneration of spinal joints, and can create bigger problems over time. So it's important to have the right pillow, and I'm going to talk more about that in just a moment. Now, if you're for left side sleeping, the benefits of sleeping on the left side: it aids digestion, reduces acid reflux, improves circulation during pregnancy, and it may also reduce the risk of developing Alzheimer's. It helps the brain clear out the waste products that accumulate during the day. The benefits of right sleeping is primarily recommended for people who are dealing with heart disease or heart failure. It's easier on the heart sleeping on the right side. Now, those are the two positions that we normally recommend: side sleeping and back sleeping. One position we don't recommend, but some people still do it, is stomach sleeping. It does have a benefit. If you sleep on your stomach, it can reduce snoring because it tends to keep the airways more open. But the drawbacks are it creates serious strain on your neck, since the head has to be turned to one side for long periods to breathe, so you're constantly lying like this during the night. It puts excessive pressure not only on the neck, but also on the spine and the lower back area. It can create a sway back, and that can contribute to lower back pain and to further break down the joints in the low back. So these pressures can lead to postural abnormalities, spinal misalignments, and, as already mentioned, accelerated spinal joint breakdown. So we generally discourage stomach sleeping unless there's a specific reason for doing it. So when you're trying to decide on what the best position is for you specifically, one thing to know is that there is no one size fits all. All right, it really comes down to your individual needs. It depends both on your body and any specific health concerns that you might be dealing with. As an example, if you're a chronic back pain sufferer, then side sleeping with a supportive pillow can be very beneficial. We'll talk more about what that pillow should look like, but one of the things we also recommend for side sleepers is to sleep with a pillow between your knees. That way you're supporting the spine from your head all the way down to your hips. If you suffer from acid reflux, I already alluded to this, back sleeping with an elevated pillow can help manage those symptoms by keeping the stomach contents in the stomach. And then if you're pregnant, side sleeping on the left side is advised because that enhances circulation to the baby and can support the baby's development further. All right? Now, if you tend to wake up stiff and sore, or you feel like you never get a good night's sleep, it may be indicating that you're developing spinal misalignments that can be caused or aggravated by your sleep position. If you'll call our office at 512-345-9355, mention this webinar, we're going to set up an initial examination, a very comprehensive examination, along with any x-rays necessary, for only $97. Our normal charge for those services is $345, so that's a significant savings. Now, in addition to that initial appointment, we'll also have a second appointment with you. You'll meet with one of the doctors. We'll review your exam findings, determine the cause of the symptoms that brought you in to see us, and also discuss how chiropractic might be able to help you with those symptoms. All that's included in the $97 price point. As an extra bonus, when you schedule your appointment, if you mention the words "sleep better," you're going to receive a high-quality cervical support pillow at your initial appointment that will help to improve the quality of your sleep. All right, we sell these pillows in our office for $55. So again, that's a special bonus if you mention the words "sleep better" when you schedule that first appointment. So what we'll talk to you about, in addition to identifying any problems, if you are having issues with sleep, we can also discuss with you, once we have the benefit of evaluating your spine with x-rays, we can also talk about what the best sleep position might be for you and help you choose not only a better position, but better pillows as well. So I just mentioned the right pillow. It's very important that you find the right pillow based on your sleep position. This will significantly affect your sleep quality by impacting spinal alignment and overall comfort. So I'm going to talk about a detailed breakdown of what to look for based on your sleep position. So for those of you who are back sleepers, you're going to need a pillow that supports the natural curve of your neck while keeping your head slightly elevated to maintain proper alignment. Now, a normal curve in the neck from the side is shaped like a banana, all right? So you want a pillow that when you sleep on it is going to support that banana shape. So that means you need a pillow, what's called a medium loft pillow. So a loft refers to the height that goes from the bed up to the top of the pillow when you lie your head on it. So the reason that you want a good support medium loft pillow is you want to, again, support that curve. Memory foam pillows are very good to that because they tend to contour to the shape of your neck and head, which provides consistent support. You also might look into feather or down pillows. They also are good, provided they have enough filling in the pillow to support that neck. You want to be careful not to go with too high of a pillow. If you have too high of a pillow, then it's going to tend to stress your neck that way, and that can lead to postural abnormalities like text neck, head forward posture, and you can lose the curve in your neck. If you have too low of a pillow, then your neck's going to tend to flatten out, which also can compromise that curve in your neck. So it's very important to have the right pillow to support the curve in your neck when you sleep on your back. Another pillow you can look into are contour pillows. These are pillows specially designed to cradle your neck, which reduces posture points, and they may look like this. This is a memory foam contoured pillow. When you sleep on this, it contours to the shape of your head and neck and does a great job of supporting that curve that I mentioned before. Now for side sleepers, you're going to need a firmer pillow with a higher loft to fill the space between your neck and shoulder. So when you're looking for the pillow that you're going to use to sleep on your side, this is a slightly higher pillow because, again, it's got to fill in that space between the bed and your ear to maintain your spine in a neutral position. You want your spine to be completely straight from the head all the way down to your hips when you're sleeping. So when you're picking out the pillow to sleep on from the side, you want to look at either a memory foam or latex pillow that's going to provide necessary support, or a pillow filled with feathers that's filled up where it's pretty firm. You might also experiment with body pillows. One advantage of body pillows, in addition to picking one that supports the neck at the right height, the head at the right height, is it can also help to be beneficial for hip and shoulder pain if you're struggling with those things. Now, the position that we don't recommend stomach sleepers, if you are a stomach sleeper and can't get off your stomach, then it's important to know you want to make sure that you are using a low loft pillow, meaning a pillow that doesn't come up very high. This is an example of a low loft pillow. It's very soft. The reason that's important is when you're turning your head this way, you're already straining your neck. The more pressure you put this way, the more strain you're putting on your neck. So if you use a higher pillow, you're going to tend to strain that neck even more. Another option, if you're a stomach sleeper, is just to sleep without a pillow at all. So again, we don't recommend that, but if you do sleep on your stomach, make sure you're keeping the pillow as small as possible. Now, the last thing to consider when it comes to choosing a pillow is what's inside the pillow. I already mentioned memory foam. The reason memory foam pillows are so good is because they conform to your head and neck, provides customized support, and also consistent support. So they can be excellent pillows to use regardless of what position you sleep in. Latex pillows are also good. They don't conform as much. They're more durable and they offer consistent support, but they don't have the sinking feeling that you might get with memory foam and probably keep you at a consistently higher level as a result. Down pillows, feather pillows, those are my personal favorite. They're soft and breathable. I sleep better. I find them more comfortable. For some people, they may not have enough support for those of you that have neck or back pain. So it's important when you're choosing your pillow, try it out in the store. Make sure that you're going to be able to support your head in that right amount of height, whether you're sleeping on your back or your side. But for a lot of people, myself included, feather pillows are going to be your best choice because they tend to be more comfortable. There are also adjustable pillows. These are pillows that allow you to add or remove filling. That gives you flexibility to customize your pillow's loft in the case that you decide to sleep in different positions. Regardless, choosing the right pillow based on your sleep position and personal preferences will greatly enhance both your sleep quality and overall health. So you want to put some time into that. All right? So to wrap up, we have explored the vital importance of sleep. We've talked about how different sleep positions affect your body and your mind and how to choose the right pillow based on your sleep position. A good night's sleep is critical both for your physical and mental health. Optimizing your sleep position and pillow can make a significant difference in how you feel and how healthy you are, and can also impact your spinal alignment, which is going to affect how well your spinal joints hold up over time. After all, we spend a third of our life sleeping, so we want to make sure we have adequate support in our spine while we're sleeping. So as I mentioned before, if you're waking up stiff and sore, you never feel fully rested when you wake up. You may have already developed spinal misalignments. These could have been caused or aggravated by the way you sleep. If you'll call our office, 888-345-9355. Mention this webinar. We're going to set up an initial examination along with any necessary x-rays. It's a very comprehensive examination. We normally charge $345 for that exam. We'll do that for only $97 when you mention this particular seminar. And as I mentioned, you're going to have a special follow-up meeting with one of our doctors. At that meeting, we're going to review your exam findings, identify where your problems are coming from. And by the way, it doesn't just have to be about sleep. If you're struggling with other issues you'd like to check out, you can still take advantage of the special offer. But we'll identify what's causing the problems that you're having from your exam, and we'll also talk about the role chiropractic can have in helping you sleep better and have better overall health. In addition, if you mention the word sleep better when you call to set up your initial exam, you're going to receive a high-quality cervical support pillow as a gift at your very initial appointment, and that'll help improve the overall quality of your sleep. Before I close, I want to encourage you to be willing to experiment with different sleep positions and different pillow types. In some cases, that will help you sleep better. Some of you may not. You may still wake up with discomfort and stiffness. In that case, it's important to get this checked out to make sure you don't have a problem that can become worse over time. Everybody's body is unique, so check these things out, but be willing to take action if you need to make sure that you're not creating a bigger problem down the road. I want to thank you for joining us today. I hope this information helps you experience better and more restful sleep. After all, sleep is the foundation of a healthy lifestyle. By paying attention to your position in pillow, you're already on the right track. Be sure to join us next month on Wednesday, December the 11th at 2 p.m. Dr. Mary is going to be discussing with us strategies to help us avoid overindulging in all the sweets we're going to be encountering during the holiday season. All right, so that's Wednesday, December the 11th at 2 p.m. By the way, all of our webinars can be viewed on our website. So if you want to watch this one again or check out the other webinars there, we have a library of about 40 different webinars. Go to our website and the New Patient Center, click on the Watch a Workshop tab. All those webinars are there, including this one after we conclude today. You're welcome to rewatch it or share it with somebody that might benefit from this important information. Once again, I'm Dr. Tom Neblett with 4 Points Family Chiropractic. I want to thank you all for being here today, and I want to wish all of you restful sleep and sweet dreams. Bye now.